My definition is any way of eating that lowers insulin levels enough to turn on fat burning and generate physiologically meaningful levels of ketones in the blood. Most low-carb diets will reliably lower and stabilize blood glucose and therefore stabilize brain glucose as well, but they don't always lower insulin levels enough to allow ketones to rise into the therapeutic range. In just the past few years, academic papers from around the world exploring the scientific mechanisms behind how ketogenic diets might work to improve psychiatric conditions such as bipolar disorder, depression, autism spectrum disorders, anxiety, and psychosis have begun to appear in the scientific literature. There's a single paper about 2 women with bipolar disorder type 2 who found the ketogenic diet to be superior to the mood-stabilizing medicine lamotrigine. There are 2 case reports and 3 small but promising studies suggesting that ketogenic diets can be helpful in reducing symptoms of autism spectrum conditions in children. There are 4 papers describing people with schizophrenia improving on ketogenic diets. There's one paper describing 3 individuals with binge eating disorder and food addiction whose symptoms responded beautifully to a diet restricted to a maximum of 30 grams of carbohydrate per day. And there's a handful of case reports and small pilot studies showing glimmers of hope in people with mild cognitive impairment and even early Alzheimer's disease.